Hello and welcome to the My Dietitian Journey podcast. My name is Adam, co-host and producer. With me, of course, Felicia Peraza of Peraza Nutrition and My Dietitian Journey. Today we have our end of year episode. That's right, wrapping things up for 2023. What's on the lookout for 24 for Felicia and the businesses, consulting and seeing patients and whatnot. Lots to discuss, talking about our year-end wrap-up and what you could be doing for your year-end wrap-up with your practice. With that, let's jump right into it. So, do you take time off over the holidays?
I used to not, and now I do, a little bit anyway, at least some time to decompress, and I find that it's actually a lot more efficient. So I usually have much more limited availability between Christmas and New Year's. Most of the time I find that most patients are a lot less motivated. Their appointments tend to be shorter. There's maybe more cancellations, more reschedules. So I tend to just have a lot more limited availability. So like I have one day between Christmas and New Year's that's available, and that's it.
Do you see appointments to start to pick up again at any specific time?
Yeah, it's interesting because I find that after Thanksgiving, some of my regulars start to drop off, and then I sometimes get new patients, but usually not anybody new until January. Usually, though, I don't pick up until February, which is something that I wasn't expecting when I first started my practice. I thought everybody was going to be knocking down my door in January, and that was not the case.
Like New Year's resolution type stuff?
Yeah, but I think people are motivated starting in January, or maybe they're starting a program, or they've already got this motivation. So they may not be seeking out a dietitian to help with that. But I do find that in February, some of those New Year's resolutions don't stick, or programs don't work, or things are too expensive, or whatever it might be. And I start to see more of the clients pick up around that time frame.
Didn't you used to get slammed at the end of the year with clients for people trying to meet their minimums for reimbursement things?
Yeah. So with some companies, they reimburse or they offer like incentive programs if their employees meet with a dietitian. Usually it's twice or the full 6 times in the year, depending on the insurance plan. And so I used to get a lot of people in December. Now I tend to get more people in September and October for those incentive programs. I just think that the way that their cycles work, it ends up being September, October when things are due. So it's a little less in December unless it is someone who's like, I need to meet 6 visits. But most of the time it's like tier 1 or tier 2, which is like see a dietitian once or twice. And so September and October, everyone's like, hey, I need to see a dietitian right now in the next 2 weeks.
So what do you do at the end of the year to prepare for the following?
Definitely spend some time self-reflecting on the business, what worked, what maybe didn't work. Thinking about things that I'm spending a lot of time on, and if it's something that I can create like a system for. And this was something that when I first started my practice became a lot more apparent after the first year in business. And I will say when I first left my full-time job and went full-time with the practice, I did that in December. It was December 5th. And so I spent a lot of time planning in December for the new year, but definitely looking at like what kinds of things I can create a system for. So whether it was, different ways of tracking my financials, or, how I'm going to log and track claims for patients, or how I'm going to onboard my patients and how that might look different. New marketing kinds of things. So who do I want to reach out to in the new year? What kind of partnerships do I want to build? What kinds of things do I want to do differently with like updates on social media or on my website or things like that? And then looking at like setting more goals to kind of go throughout the year. So it's not just like, okay, I have this long list of things that I want to be doing, but kind of breaking it down as to like what that can look like weekly or monthly, or even daily at that point.
So you have certain yearly goals and objectives that you hit that are a priority once per year. What are those?
Yeah, so one of the things that I do every year is I update my business forms. And sometimes I do this throughout the year. Like if I notice that there's an issue with a certain document, or I started actually adding to my intake form for patients to ask if they've been working with a mental health professional, if they have in the past, or if they're doing so currently. So there is obviously certain times of the year where I'm just updating things as it comes up. But I do look at things like my HIPAA documents, my privacy practices, my practice policies and go through and update those. Just taking a scan through if there's any different language I want to add, or for the longest time with my practice policies, I had a certain fee associated with like no-shows and cancellations. And I've kind of changed that over the years as to what that fee looks like. So those kinds of like documents I'm usually updating consistently on a yearly basis, but if not throughout the year. And then usually certain documents like the notice of privacy practices has to be posted on the website. If you're in private practice and you work with patients in person and you have an office, you have to have that posted along with having it posted electronically. So all patients need to have access to it. So they all get a copy of that through their portal, plus it gets posted on the website. So if there's any updates to that or to my practice policies, all of that has to get updated, and then also on the website, and then making sure that everything's updated in my EMR, or if I have any digital copies of those on like the computer, make sure that those are all aligned so I have the most up-to-date version for everything that I'm doing. I'm also looking at things like service offerings, so adjusting the language, if I need to change anything with like rates. That's a little less with my practice, like for Paraz Nutrition, like the patient-focused one. For my dietitian journey, there's been some updates as to like what kinds of services are being offered, or, you know, what those rates look like. Or just recently, I think this week, I updated some of the language associated with those services. So again, something that I might also do throughout the year as it comes up, but definitely something I make sure that I spend time on in the beginning of the year as well.
Do you want to get into, we just did our HIPAA training.
Oh,
HIPAA training.
HIPAA training.
Big, crazy training. Do you want to get into that and why we have to do it every year?
Yeah. So HIPAA, so we have a HIPAA training checklist, and we have to go through all of our things, but we have to do a yearly HIPAA training as well. So HIPAA training is mandatory for any members of the workforce that are covered entities. So that would be registered dietitians, and then also their business associates, and then basically anybody who is involved in handling PHI. So HIPAA doesn't specifically have like a standard for training. The best practice is that it's done on an annual basis. But if you have anybody new to the practice that is working with PHI, it has to be like within a certain window of time. But PHI obviously is something that you want to make sure that you're handling in a proper manner. And so with HIPAA training, anyone who's onboarded, but on a yearly basis, making sure that you're going through HIPAA training. So we just did ours both separately. We both had to go through it. I do one that's like HIPAA for healthcare professionals. And then I forget what yours was called.
It was like a 360training.com HIPAA compliance survey thing. It was like a class where I had to do a quiz. I don't know.
Yeah, and yours was specific to like HIPAA for medical office staff. So there's different ones for like a healthcare professional, or if it's like a biller or a medical office, or just,
mine was clearly not geared for a provider.
Really?
It was clearly for staff only who had to deal with interactions in and around a medical office.
So that's something important to note if you're going to look at training, that if you have different people that are working within your company, to make sure that they have a training that's appropriate to the role that they have. I think the rate was like $28 per something, $28 or $30 for each of us to get done. It's something that you also include in terms of like your tax write-offs, but saving those certificates. So if you ever get audited, you could prove that you've been doing, these HIPAA trainings on a regular basis. And then also that anybody that's involved in the practice also has HIPAA training as well. And it was pretty easy to go through.
Oh, I mean, you do this a few times and it becomes second nature. Also, if you're in this profession for any amount of time, you get HIPAA jammed down your throat. Felicia and I started out working in hospitals and food service, and we had to learn about HIPAA at that level. So if you're at this stage of the game, HIPAA should be a pretty easy bag for you to handle. Yeah.
And I will say too, because this is something that comes up, is that you need to be following HIPAA as a registered dietitian. And that has, insurance obviously is going to require it as well. And that's built into, contract language. But as a dietitian, you are a covered entity. So whether or not you accept insurance, that has nothing to do with like you needing to follow HIPAA. So I think that that's something that comes up a lot, is like, do I not need to follow this if I'm not, billing insurance? But you still need to be following it as a registered dietitian, as a covered entity. And that's also in like the ethical guidelines as a dietitian as well from the academy, to make sure that you're following HIPAA. So
Yeah, one of my questions was, do you need to follow HIPAA if you're not part of a private practice?
Oh,
Obviously, the answer is you need to follow HIPAA regardless of whether or not it's a private practice.
interesting.
That was one of my questions.
I didn't get that question, which
Yeah.
makes sense if you're, medical office staff, in a practice, but
Yeah.
that's interesting.
What else? What else do you do yearly?
Scanning. So I still have some paper documents, paper charts, and I also still get paper EOBs from some insurance companies that I cannot figure out how to turn off for some of them. And so that and checks, if I get any paper checks from certain insurances or any kind of like contract information from an insurance and it's something that they've mailed to me, I have those filed in a filing cabinet that's locked, and I scan those into a flash drive that ends up going into that filing cabinet just to reduce the amount of paper that I have. But I go through those documents, scan those, and then I also create a new financial spreadsheet every year and close out any like financials for that year prior to.
So, is there anything that you do specifically for tracking financials?
Yeah, so I was just talking actually to somebody about this recently with how I track, financial data. And we'll talk a little bit. That's something that I do on a monthly basis, is kind of like look at that financial spreadsheet. But I used to do all of my financial tracking like on paper. And then I switched to using QuickBooks, which we've talked about in another podcast before. It's a really great tool. I used that when I first started my practice. They have an app. You can integrate it with your bank account, and you can kind of like not just upload receipts, but you can log things as different line items. And it's a really great platform, especially for a small business. And it's very user friendly. I moved away from it only because of just liking the way that a spreadsheet looks, which is, I'd say, not the norm for necessarily everybody, but I use Google spreadsheets now, and it's just something that I prefer the layout so I could track my personal and business expenses. But in terms of like what I'm actually tracking, so I'm tracking my income. I actually have it separated by insurance company to see who are my biggest, where my income is coming from primarily and which insurance that is. I also look at any of all my business expenses as well. So everything from my EMR to the phone to email to marketing type stuff, all of that gets put in the spreadsheet as well. And then I also track things like actual office expenses, any kind of like media equipment, if we ended up getting, a new camera, which we got a couple of years ago at this point, but or microphones or things like that, that all gets logged under business expenses as well. So those are things that are also tracked in that spreadsheet.
What do you do on a monthly basis to stay organized?
So definitely updating my website, which sometimes is just, and I will say for updating my website, I use a GoDaddy builder. So it's like drag and drop. And so I have access to everything in terms of like building out the website and going in and updating it. If you hired somebody anyway to build your website, you may not be able to do this on such a consistent basis that I do. But I go in and I just check my website language, just make sure everything is, as it needs to be, or update anything about my services. Primarily, I'm also looking at like broken links too. So sometimes I find that if I'm linking off to something or like podcasts or something, I might need to update those. But usually I just try to make sure that the website is as up to date as it needs to be. And if there's any language changes that I want to make within like my about section, or if there's something about the services, whether it's for the patients that I'm working with or with coaching clients, to make sure that's updated as well.
Just to mention, any brand that we bring up is not an endorsement of that brand. So GoDaddy is not a sponsor. We didn't get a discount. There are lots of services that offer lots of companies offer comparative services, Squarespace, Wix, WordPress. I mean, use whoever. It's cheap. Really, get a deal if you can.
Yeah, and we're actually, one of the things that is kind of, and we'll talk about like what's in the works for next year is building out a website, and we actually are going to use Squarespace, so which is different than the website builder that I'm using right now for my Paraz Nutrition like patient focused one. So
yeah, if you're in the business of getting your own website, there's a lot of builders that are very intuitive, easy to use. You pay on a monthly fee. You don't need to hire someone to build you a website anymore. That's such an antiquated thing to do, and it's a huge waste of money if you're just willing to learn a system. It's all very easy to do now. But yeah, we're we're moving to Squarespace just as a convenience. And a lot of them build in hosting and other services too, so you can get a package deal. It's kind of the idea.
Yeah, and actually, if you're using an EMR, a lot of EMRs now, what they have, like I use Simple Practice, and it's one that I talk about a lot. We have a podcast on EMRs and some of the more popular ones out there, but with Simple Practice in particular, they actually have like an upgrade on the account where you can build a website with them. It's basically like a one-page like landing page almost, and it has like contact information, services, people can book right then and there. So if you're not feeling confident about having like this, whole website and getting, hosting, looking at all that kind of stuff, even just going through your EMR, and then that's all just kind of integrated, especially if you're just using it with working one-on-one with patients, or if you do like group sessions or things like that with patients, that could be another avenue too. And those are really simple to use, and they're pretty basic, but they get the point across, and they have everything really that you need just to kind of say like, hey, I'm a dietitian and, schedule to work with me.
Yeah, I guess the only product we do endorse is Simple Practice as an EMR. I just said that caveat, but we do have an affiliate link in the description where we both save money if you sign up, and we get a kickback too. So it's a great product. It's probably the best in the business at least for dietitians in terms of an EMR and all-in-one solution. So consider checking it out this year if you're looking to get an EMR, finally pull the trigger for your business.
Yeah, and with any EMR, again, something I was just talking to somebody about is go through the free trials and put in a mock patient, which can be yourself, and something that I would suggest, because that's the best way to really understand which platform is going to work the best for you, which one you like in terms of design, what's going to make the most sense. And also think about like what you need. Like a lot of them at the base rate could be cheaper than, let's say, Simple Practice. But then when you add in things like having to do the billing and then also adding in like telehealth, a lot of the platforms tend to be on the same playing field in terms of like how much it's going to cost. So definitely looking at like what you really need, and then really putting in a patient, or again, yourself, to be able to see like what it looks like from the patient end and the workflow. And if you like that, because there might be a platform that you go with primarily because of the way that you like the way it's designed in terms of the, the system flow. So just something else to keep in mind. So
what else you got for monthly stuff? What else do you think about?
So something I used to do, which I'm pretty terrible at now unless I have a intern, but something maybe you might think about in terms of putting on your to-do list as a dietitian, is like your newsletter or planning for blogs or things like that. I've kind of started to think about if that's worth my time. Is that something where I'm going to be reaching more people? And, I'm definitely slacking on that in terms of like Paraz Nutrition and my dietitian journey. I have 2 newsletters set up, and I have like a landing page on the website, but I haven't really posted too much or sent out any newsletters. So if you were someone who signed up for the MDJ newsletter and you haven't gotten one in a while, it's because just slacking there. But anyway, financials would be another thing that I mentioned that I go over on a monthly basis. So I make sure everything's imported into a Google spreadsheet that I use. And then I also pay estimated taxes quarterly. So every month I have on there to like make sure when the next round of estimated taxes is due. And keeping organized on that on a monthly basis is really important, because I work with a tax accountant, and actually because I'm organized, like she works with some people who are very unorganized, and the price point goes up more based on how many receipts she has to sift through. So keeping everything organized in a spreadsheet is helpful for me, but also helps to save me some money when working with a tax accountant. And then I also look at, I track outside of financials, like the number of patients that I've had that's scheduled for the month, how many reschedules, how many cancellations, how that compares to the month prior, and then also the year prior, that same month. So I look at like October 2022 and compare that to October 2023. Did I have the same amount of patients? Did I go up? Did I go down? And then also again, looking at like cancellations and reschedules. And that's kind of where I started to realize that like December, November, I wanted to scale down some of the times that I was offering, because again, I was just finding more people canceling, rescheduling, and it ended up being not as worthwhile in terms of my time. I also track things like coaching calls that I have with other dietitians, but then also the number of like free calls that I have. So again, just trying to see if there's any kind of trends as to like different months. And then, tracking and looking at things like personal things that I need to do, like paying bills, but also, paying off like the credit card for the business and things like that, which is something that, definitely need to stay on top of, because especially with like business expenses, you want to make sure that you have the money that you need to pay anything that you are expensing on your cards.
So you want to break things down to a weekly basis?
Yeah, so I use, again, we're not sponsored by Google. I just tend to use a lot of Google products.
They're free.
Yeah, especially things like outside of the business ones. So like if you're using Google, that's Google Workspace. It used to be called Google Suite, but it's Google Workspace, the paid version of that, which is HIPAA compliant, which we do have the HIPAA compliant version of that because we use Google Voice, and that has to be HIPAA compliant because we're using that to interact with patients. But like just regular Gmail or Google Calendar, Google Tab, all that stuff is free.
Google Drive.
Google Drive.
It's amazing. We use that all the time, every day. It's free.
That is definitely a good resource, especially when you're like for podcast outlines, like being able to send it to each other.
I'm looking at it's Gmail, but it's all on Google. We use everything.
Yeah, it makes it a lot easier to just have everything in one spot. And this is also, one of the things that I do on a weekly basis is to check the claim sheet that we have, which is also something we have on a shared drive together. So we track all of the claims. So every time I see a patient, I put in, a claim document, the date of the service, the patient initials, the platform that's going to get submitted on, which is kind of redundant at this point.
Simple Practice is sort of an all-in-one solution. We occasionally run into issues with weird plans we don't take that much. It's pretty rare anymore. Sometimes I'll occasionally just file on Pair or I guess, what is it, Navinet anymore?
Yeah.
But just to stay fresh with being able to go to an external platform, but you really don't need to anymore.
No, and that's something we're going to probably take out of that spreadsheet, because we used to, like Adam was saying, like submit claims on different platforms.
Yeah, I used to bounce around from like between 3 or 4 different platforms submitting claims, and then we started to dial in what was offered on Simple Practice. We just weren't utilizing it.
Yeah.
But once you get the back end sorted, you can just submit everything on Simple Practice. Yeah, most EMRs work that way too. Practice Better, linked up with Office Ally. It's the same sort of thing. It's really what you should do if you're paying, because you're already paying for it.
Yep.
So you get X amount of claims for free submitted, and then they go through their clearinghouse, and it's like one less thing you have to worry about. But we used to bounce around between different platforms.
Yeah,
not anymore.
Having it all in one EMR too, you can one, get your EOBs or ERAs technically that way. And that makes it a lot easier, because then it's like, hey, a claim has been paid, and you don't have to like go to each platform to check things if you're not getting a check in the mail kind of thing. But the claim sheet, that's something that I take a look at on a weekly basis, just to see like, okay, how long has it been since some of these claims have been submitted and not gotten paid? Because usually if it's not paid within like 3 to 4 weeks, usually there's an issue in terms of like, coverage, or the insurance company being really frustrating and not paying for something that they need to be covering. And so, kind of figuring out what, insurances need to be called. So checking in on that claim sheet is definitely something. Checking the forms for the following week. So kind of how I stay organized with patients and onboarding them into the practice. So once a patient calls to schedule an appointment, so sometimes those calls come to me because I've been updating the phone number, so they all go to Adam. So he's the one that's calling the patients back. He puts all the information in terms of the system. But once all that information is in for the patient, sometimes they don't fill out the paperwork right away. And so on a weekly basis, usually I do this on Fridays, I look at the next week's appointments and I see what patients are having an initial appointment. Do I have all of their paperwork in? Do I have their insurance cards? Do I have their photo IDs? Do I need a referral? Do I need, labs or something on file? And I go through and check that. Now, with Simple Practice and with a lot of EMRs, there's a functionality in there that you can have reminders for completing documents. This was something that Simple Practice, I think, just recently added within the last couple of months. So all of the patients have this checked in their profile, where if they don't complete a document, it'll say like, you still have documents to be completed in your portal. And this is helpful because it eliminates how much time I have to spend sending off emails and whatnot. So that's usually something that I do first, is I, check all of those things. And then, usually either sending a message through the portal or emailing the patient, or in other cases, the patient needs to get called to be reminded about the paperwork. And this is something that we require 24 hours prior for them to submit their paperwork. But sooner, if we need to have information so we can actually call to verify benefits, or if we need to get referrals on file or whatnot. So that all is something that I'm usually checking in on Friday to see what needs to happen by what time frame the following week, and making sure that that's all taken care of. So not looking at like, oh my gosh, the patient appointment is the next day and they haven't filled out their paperwork, we don't have a referral on file, anything like that. So usually it's that week prior that I'm looking at those patient appointments and making sure that everything is there that needs to be there for the first appointment and for billing, for the insurance as well. I also look at, as I mentioned, I use Google Keep a lot. So I usually organize my to-do list for the following week. What kinds of things do I need to be doing? I update my availability in Simple Practice on a weekly basis. So that's something I have to manually enter in. I don't do recurring availability much, just for my schedule, only because things come up in terms of like other meetings, and I work full-time also as an assistant professor. So I'm not usually having these like recurring availabilities that some other people might be doing. And then also looking at content planning. So, when am we going to do a podcast? When am I going to record a video or things like that? Putting it on my schedule, putting it in my calendar, but then also when am I going to actually write the outline for that? So again, I look at that on like a Friday and plan that for the following week.
Assistant professor makes it sound like you're helping another professor out. You have your own classroom. You teach like 7 classes by yourself. You're a professor. Your title is associated with the college's determination of status.
Yeah.
You're not helping another professor out. She's a full-blown academic, folks, teaching full-time college students, molding young minds. So, speaking of which, 2024 is going to be a big year for you. What's in the works?
So one of the first things, I guess this crosses over into a few areas, but going for my PhD. So I decided that after some careful thought and some discussions to go through and pursue a PhD. So I am going to start in February of 2024. It's a PhD in psychology with a specialization in health psychology from Walden University. So I'm pretty excited about that. Just a little bit of nervousness associated with it because, I don't know what to expect. I obviously did a master's program that was online, but that was 1 year and did not involve a whole dissertation and, all of that kind of stuff that comes along with like research and everything. So, but I'm also very excited because I feel like that psychology piece is something that is a gap. I have some basic understanding and, my own personal, endeavors of looking at stuff, but I think that's going to be really useful to kind of tie into terms of knowledge base in working with patients for sure. In terms of like my dietitian journey, some planning stuff there. Definitely want to get into more short form videos, doing those on like a weekly or a bi-weekly basis. And then kind of thinking about podcasts, maybe doing like monthly or something, kind of more prioritizing some of those short form videos, and adjusting the services a little bit. So I have on the website right now, like coaching and mentoring, and then like a one-off session. And I was just talking to somebody yesterday because they were like, what's the difference between the coaching and mentoring? And I'm like, honestly, it's more about the time frame than the spending, because I'm kind of using coaching, mentoring a little bit interchangeably when they're, obviously 2 different terms, but might be looking at updating some language just to have that make a little bit more sense.
So for you, is coaching more direct contact and more influence, in mentoring is a sort of more guided approach where you're stepping back a little bit? Is that how you're defining the two?
Yeah. And like with mentoring, I guess the way that I think about it is like mentoring, if I was mentoring a student, like there's a lot more like, I hate the way of phrasing like hand holding because it sounds so like, I don't know, it doesn't sound right, but it's a little more involved. I feel like mentoring, where I'm like really working with someone like on a daily basis and like having long interactions with them. At least that's the way that I think about it.
Well, it was a very different. It's different. I don't know. I'm coming from like a business side of it than more than anything. When I was coming up in management, mentorship was just having the older, more experienced person at the access of like email occasionally, where they would, hey, I need some advice. That's a mentor. Whereas like a coach is someone who's in the weeds with you every day. It depends on how you're using that term, I guess. But that was my impression of it.
Actually, I guess that makes sense though, because coaching, the at least right now, the business coaching package that I have is weekly, either calls or video sessions, and then like emails and like, more documents. And that's like more of like when you're starting your practice, when you need more time, versus the mentoring one. It's like one session per month. That's 45 minutes. And then weekly email check-ins, plus, you can email me basically whenever you want. So that kind of is more of like the mentoring that you're describing. I think kind of where I was looking at like the coaching mentoring language is I was kind of wondering like what most people are using. I feel like when people think of coaching, they think business coach, that kind of thing. But I don't know, it's something to maybe look into as to like, what's the language that's being used?
Yeah, like a coach is someone who I think helps you solve your problems directly, gets involved directly, takes steps with you. Whereas a mentor is more of a guiding force, sort of like helping you correct course along the way, more than anything.
That makes sense. So that's something that I definitely want to update the website, because someone was asking me about it, and I'm like, I have the service created obviously, but couldn't really speak to too much as that being very different. So then I was like, maybe they should both be coaching, but that's something where it's like needing to,
you're going to tune your services up. It's one of your goals for 24. The website being built from the ground up for MDJ stuff is going to be impactful for that too.
Yeah, definitely. So that's definitely on our list to update, to create a new website. So right now it's like Paraz Nutrition, and there's a dietitian tab where all like the services are for dietitians. That's going to be its own website because they are two separate companies. They have two separate LLCs, tax IDs, all of that kind of stuff. So they really are two things. And the MDJ website is going to be built out to have more resources, more tools. We're going to be trademarking that as well. And we also want to do more things that are going to be continuing education. So like the podcast, or videos or things like that, to have continuing education be available for dietitians. And so to do that, we need to make sure that that's on its own website, because there's going to be, have its own website, because there needs to be other stuff that's updated there as well, like having, logins and being able to submit, quizzes and download certificates and all that kind of stuff. So that really needs its own space, which is in the works for 2024. And then the only other thing with Paraz Nutrition that I'm really looking at is optimizing my patient schedule, which I feel like I say every year that I'm going to like optimize how my patients are scheduled. But just looking at like when I'm scheduling patients and kind of having more consistent blocks, like whether it's Monday, Tuesday, Wednesday, Friday, or, having late nights on certain days. And I think part of that is to create better work-life balance, but also not burn myself out. And with having the PhD, to kind of being something that I'm starting to make sure that I'm spending enough time on that. And then also, personal life as well, and not, again, burning myself out too much.
Well, you can continuously optimize anything for your whole life. That's part of optimization. It's reflecting and then changing. So that's fine that it's every year. It should be every year.
Yeah.
So you think that wraps us up here? What do you think?
Yeah. I think that's everything. One thing, actually, I will say that I've been kind of doing at the end of this year, but is something that I kind of think about on a yearly basis. And again, more often than not, is trying to let go of things that are no longer serving me, and like questioning if I'm doing something because I feel like I should be doing something. Is it providing value, or do I just feel guilty that I'm going to say that I'm not doing it anymore? And so asking myself those hard questions, and also talking to you about it, Adam, has been very helpful. So if you don't have a person in your corner that you can really have these kinds of conversations with, that might be something to also look at, for 2024, and whether that's someone in your personal life or professional life, or whether you go with working with a coach or something like that. But really identifying the things that you're doing now. Are these the things that are serving you? Are they helping to advance your career, or are they things that you really find enjoyment in? Or are you doing them out of like obligation and there isn't a need to do it, but it's like, I feel bad saying no. So being able to learn to say no and be okay with that is something else that I am working on.
Yeah, we trimmed some fat this year for sure. It's something that is painful, but it feels better after it's done.
Yes.
Yeah, depending on what you're doing, if something's not worth it to you, gotta let things go. That's sort of, it's tough, but important.
Definitely.
All right, so with that, I guess we can wrap it up here at the My Dietitian Journey podcast. Don't forget to rate, like, and subscribe. Slam the bell or whatever. Yeah, whatever the YouTube people say. If you're listening on Apple, Spotify, or Google, please rate us on those platforms. That helps immensely to reach a wider audience. And with that, that'll do it with us here at the My Dietitian Journey podcast. Thanks so much.